Hey Doc, can you tell me about COVID-19?
It's a really good question. Let's talk about COVID today. So COVID-19, it is a disease that starts with sore throat, fever, and that can lead to shortness of breath and respiratory distress syndrome, and ultimately acute respiratory failure. COVID-19 started in 2019 in Wuhan state of China, and it is the RNA virus. It's a RNA single stranded virus, and it is very contagious in nature, and it spreads very quickly. It can lead to respiratory failure of the person as well, and can cause death. So now let me explain you about the virus cycle, how the virus is spread and how it can enter your body. So if somebody is suffering from COVID-19 and you come in close contact with him, and he or she sneezes or cough, so it is spread through respiratory droplet of the person who is having COVID-19. When you inspire the respiratory droplet of the person, when you intake the respiratory droplet of the person that's having COVID-19, so the virus will enter inside your body. Once the virus enters inside your body, it will directly go to the lung cells, and it will enter the lung cells. Once the virus is penetrated inside your cell, it will try to take the control of the nucleus of your cell, and then it will generate its own protein, and it will stop the production of your cell protein, and it will generate its own protein, and it will divide inside your cell. Then your cell will burst and the virus will come out, and in this way the more viruses are formed, and when you sneeze or cough, the respiratory droplet come out of your body, and then you spread the virus in this way to others. Now let me explain you about the transmission of this virus. This virus can be transmitted from human to human, as I explained. This virus can also be transmitted from animals to human. If some animal have COVID-19, and the transmission would be same if somebody eat that animal. If the animal is sick and cough and got the respiratory droplets spread around, and you intake that respiratory droplet that's having COVID-19, you can also get infected with COVID-19. And this can also be transmitted through asymptomatic person. If some person does not have any symptoms, so that does not mean he is not having COVID. There are few people who will not get symptoms even if they are infected with COVID-19 virus, and these people can be the cause of spreading to others, because they are unaware of the situation that they have COVID-19, and they can spread to others. So that's why everyone should take precautions and wear mask and avoid to come close contact to other people. Now I will talk about some of the symptoms related to COVID-19. We can divide the symptoms in two types. One are general symptoms and one are severe symptoms. So the general symptoms could be sore throat, running nose, coughing, sneezing, and high-grade fever. And the fever comes with chills. And you can have severe headache. You can feel the joints pain, your muscular pain, all of the body generalized pain can be felt with in the general symptom of the COVID-19, and loss of sense of smell and taste. And you can also feel shortness of breath, chest congestion, and COVID-19 also includes the GI symptoms as well, that is nausea, vomiting, and diarrhea. Let's talk about some of the severe symptoms of COVID-19. That could be severe shortness of breath, congestion in the chest, tightening of the chest, feeling heaviness in the chest, feeling severe pain in the chest. One of the most important thing is that your oxygen levels go down and your lips can turn blue. You can feel confused and you are unable to walk. These are the few symptoms that requires urgent care. Now let's talk about some of the precautions that you can take to prevent the COVID-19 spread. I will talk about two types of the precautions. One for the general public that everyone should follow, and this will help in spread of the COVID. And the second is specifically if somebody is a victim of the COVID-19, what he can do to prevent the spread of COVID. First thing first, we should avoid social gathering and keep safe social distance between us and other individuals. Second thing is that we should take care of our cleanliness. We should make a habit to wash our hands all the time we touch any surface or any other thing. We should use hand sanitizer if we are not able to wash our hands. Even when you fill up the gas on the gas station, you should use the sanitizer, or if you could wash your hands, that would be really good. When you come home from outside, you must try to take shower and change your clothes before you come and sit with your family. And the most important thing is that everyone must wear face mask or face coverings. Now let's talk about if somebody is a victim of COVID-19, how he or she could stop the spread of the COVID-19. First of all, one should not go outside the house until unless it's very necessary, and avoid the contact with the other family members as much as possible. Even if one is inside his own space, he or she must wear face mask or face covering. He or she should keep the habit of washing the hands and using the sanitizer. One should keep the surface clean with the surface disinfectant. So that's it. Let's keep our immunity strong so we can fight with all these kind of viruses. Eat fresh fruits and fresh green vegetables like broccoli, spinach, ginger, garlic, fruits like citrus fruits, oranges, mangoes, apple, lemon, lime. You can also eat almonds, sunflower seeds. These will help you to boost your immunity and will make your immunity strong. This is your Dr. Siddiqui here, and if you want me to speak on any other medicine related topic, comment below and I will try to speak in my next video. So that's it. Stay safe, stay healthy. Goodbye.